Hello students, I will demonstrate today how to do continuous locking sutures. Here initial bite is same, needle holder, lock should be locked, needle should be placed in the middle of the needle with the proximal to the distal one third of the distal jaw of the needle holder. Then take the bite perpendicular needle bite from the entry point, then to the exit point, then put a starting knot with the reef knot. Then after that you take the bite, next bite you take around 5 millimeter from this one, equidistant from the wound margin, from the entry point and exit point both. Then while taking the bite from the exit point, whatever that leading end of the suture material it is there, already told, you know that suture material has got a tail end or trailing end, then leading end, then bait where you make a bait part is the one where you make a loopy knot. So leading end should be passed through the needle where material you have taken the bite so that it locks. So like that you take that, once you tighten that it becomes like a blanket or continuous locking sutures, and then take further bite again maybe 5 millimeter from the equidistant from the entry point and exit point. Again loop should be looped, leading point end of the suture should be looped or locked. Then continuously like that you go until the wound edge is reached. Then at the end again, like in simple continuous suture, through the loop, terminal loop, you make a knot. Initially surgeon's knot, then reef knot halfway back from front behind like that, 3 to 5 half knots you put to complete the continuous blanket suture. It is also called as forward suture. One advantage is it locks well, it holds the suture material well. Meantime, eversion is not there, good deposition is there. Tough structures are sutured like that. So it is a continuous one. It's a blanket looping of the exit point of the bite you will take, and it has got a starting knot and terminal knot through the loop. So that's how exactly you will, it is done. So I will demonstrate that one. So I will demonstrate continuous locking suture now. So it is to hold in the deeper structures, many times they will use. So other things are same like what I have shown in other thing. Needle should be perpendicular, then exit to point and entry point should be entered properly. Then this is the tail end, trail end both are same, bait, leading end. Then I am putting the surgical knot here. I will loop it. I am putting the reef knot so that it won't slip. I have put the 3 knot. I will hold the end like this. Now this is important. Usually assistant will help you to hold this one. Now I am doing one myself. Now I will put the locking sutures. See that? Like this. So I will lock it like this. So it is locked like this. So this is called locking sutures. So take bite like this, again perpendicular. That principle is same for bite. You can do entry point, exit point together or separately depending on your convenience. Now this locking is very important. It is the continuous locking suture. So that holds well tissue. This is what especially tough structures we will use that. Again like this, locking. So see that, like that locking sutures you have to put. This is the locking sutures. Like this. So after that you will put a knot. So again same, this is the starter knot, this is the terminal knot. Again that knot placing is same like this. Put a lock, put a square it actually. Then reef knot I am putting again to the loop. This terminal knot always to the loop. Remember. So like that, 3 or 5 knot you have to apply. So see that, hold it parallelly like this. So that is how exactly you will do the continuous locking suture, or it is also called as blanket suture. See that, this is also called as blanket, like a blanket. See that, like a blanket it is. It is blanket suture. It is the tartar knot, it is the terminal knot. Like that, okay? Whatever the length, if you want, you can do same thing, like a blanket suture. It's continuous locking suture, otherwise called as blanket suture. So students, I hope they have understood this continuous locking blanket suture, how to do it properly. Thank you very much.